Good morning. I'm really pleased to be able to be a part of this. This is a topic that is very near and dear to my heart. I think being a frontline supervisor in child welfare is certainly the hardest work I've ever done in my life. I'm sure many of you in this room have had that as a part of your career. I've been asked to, in 15 minutes, go over what the research tells us about why we should invest in enhancing supervision, and I would suggest not just invest in enhancing supervision, but invest in making it possible for supervisors to do this work in the agencies, because I think a lot of what we're missing is the support and the resources that they need to do that work. I need to apologize in advance. I have quite a cold. I hope I won't be coughing a lot, and in my head I sound a little bit like Lauren Bacall on a very bad day. So I hope my voice is more clear to you than it is in my head. Okay, so I'm going to have to move through this very quickly. Why is supervision important? You know, one of the early areas of research that we really, came very clearly with was the relationship between burnout and stress and frontline supervision, turnover and retention, and directly related to that being that organizational culture, and really the supervisor being really the translator, the interpreter of that organizational culture and climate on the front line that makes it possible for staff to do their work. And over time, and not all of these citations are child welfare specific, they are in really child and family social work practice, but many of them are. We've begun to build quite an evidence base linking the quality of supervision and workers' perceptions of supervision related to an array of client outcomes and also worker practice, the ability to assess and treat families, risk assessment, client engagement, goal attainment, and child welfare outcomes specifically. So I think that what we've grown to understand in this field is that the relationship between the worker and the supervisor is really where our efforts in our child welfare organizations to improve organizational culture, to retain quality staff, to improve performance, and to enact the kind of organizational change that we're all very involved in doing. That is where it really happens. It's in the relationship between the supervisor and those workers. Joan mentioned this morning some work that two of the National Resource Centers did, and I had the privilege of working with them on this project. You know, I think the Children's Bureau began to realize not too long ago that the emphasis on supervision was one that really needed some support. A lot of states were trying to take on improving supervisory practice in the front line, and there began to be kind of this bubbling up question about, what does child welfare supervision really look like? Are there ways that supervision in child welfare is perhaps different than other types of social work supervision? And so they conducted a literature review, had a working group of interested folks related to this. Other folks in this room were engaged in that work, and then conducted key informant interviews with practitioners, supervisors, administrators across the country to try to get an idea of what does child welfare supervision look like. And this document is on your flash. There's a lot on this slide, but these are just those job responsibilities that those interviewed felt like were most important or important in the administrative, what Peg and Susan labeled administrative supervision. Now, some of these things, many of us in the room may say, well, I'm not sure that this is really purely administrative. Recruiting and retaining staff, evaluating case work performance, the organizational culture piece, all of these things bleed over beyond, I think, what was traditionally seen as administrative. And this has the other two categories. Educational supervision in terms of helping staff analyze what they're doing with cases in terms of ethical practice, self-reflective practice, critical decision making, evidence-informed practice, which we're going to talk about in a few minutes, and then supportive supervision, where we're really trying to reduce stress and burnout, enhance job satisfaction, and keep quality staff on the job. I don't know about you all, when I look at these two slides in this list, and these are just the things that were important or most important. I can't even imagine the list that would be sort of important or also necessary. And it made me think of, when I was a supervisor a few years ago in Kentucky, they did a work process study to try to get a handle on what the job responsibilities of the frontline supervisor was in the agency. And what we came up with was such a list that many of us in the room who were frontline supervisors all of a sudden realized, I know why I'm so tired, because the list of responsibilities is just so huge. So there really is a lot that we're asking these frontline supervisors to do. Joan mentioned the Southern Regional Quality Improvement Center work that the Children's Bureau funded. One of the things that we did in our first year was a 6-state survey of frontline supervisors and workers, trying to get a sense of what was happening in child welfare practice at that time. And I realize this is a little bit dated, but one of the questions that we asked them is what should be the primary responsibility of supervisors in child welfare? And you can see that overwhelmingly people felt like supporting the work of the line workers should be what we're focused on, supporting the work. And then when you see over here on the black box, those are those items where people felt these activities were most important for supervisors to be engaged in order to support quality work with clients. We asked what ought to be, but we also asked what is. And at that time, at least, what we heard was that what the focus of most supervisors in these 6 states, at least, tended to be those administrative tasks. Those, reporting and some of those things that the agencies, were more and more asking the frontline workers or supervisors to be doing that took them away from doing casework supervision or more clinical supervision. And this is what led us to doing the 4-state study on clinical supervision in child welfare to see if we could improve outcomes. And I think it would be interesting if we were to take a look at this again and ask really what is the status now. Because more and more states have embraced this idea of returning back to more clinical supervision and frontline supervision and really getting back to helping workers improve their interaction with clients. And so I hope we're making some headway in that regard. We don't have really time to talk about everything that we learned in that particular study. It was a 4-state study. We used a quasi-experimental design. You see the states there, and the states were able to really design what they considered to be clinical supervision, but we did have a number of required aspects of that model. And across the study, we found a number of very promising outcomes in the cross-site evaluation that really demonstrated, we think, a lot of potential for investing on that more clinical aspect of supervision, the supportive and educational piece, critical thinking and self-reflective practice in terms of perceptions of supervision and the organizational culture, intent to remain employed, self-efficacy in child welfare tasks, trends in case outcomes. We did not expect in 3 years to see that to be able to demonstrate statistically that child level outcomes were improving based on a supervisory intervention. But what we did was look at trends in case outcomes like repeat maltreatment, like the ability to close a case within a year and keep it closed. And then from a qualitative standpoint, in all 4 states, we saw a lot of very promising information in terms of workers adjusting their practice to a more strength-based approach with clients, being more engaged in their case planning and their treatment and a whole array of things. Now, we also saw in these, and you can see that some states saw the favorable findings in this and some did not, and it's a kind of a mix. Some states saw different things. And I think one of the things that was most important that we learned from this four-state study is how the way you approach putting that out there in the field and how you support that work can really impact outcomes. We had, for example, one state that, we're doing this work on supervision and hiring freeze went in. They started moving the supervisors to be covering 2 and 3 counties at the time that we were trying to help them build these relationships with workers. So there's a lot to be learned about that. Really, the last piece that I want to highlight is a little bit different, and this actually comes from the work that we have been doing on the public-private partnership piece. This is not a study about supervision, but one of the things that we wanted to do, and this is a 3-state study, we were looking at performance-based contracting and quality assurance systems, and really what we were trying to do is see if we could drill down this really a CQI process where supervisors and workers were using data to assess their own performance over time. And so this is really just preliminary data, but I just wanted to share with you the wide variance that we've seen in this baseline data in terms of the 3 states, in terms of how workers and supervisors describe what's happening in terms of use of data. One of the things that we ask them is how often is your team, your organizational unit, involved in this array of activities that you can see there in order to look at what that information means for their work with clients. 3 is that kind of in the middle, neutral sometimes, which is, of course, where most of this lies. And in here you can see, looking at performance information on their own data, state-level performance indication, research on their own practice and all of this, and across the states at kind of a middle range. We asked supervisors whether or not they were doing a number of things while they were having their interaction with staff, using data or evidence or reports to guide practice, using research findings in supervision, role-playing or modeling client scenarios, talking about clear expectations to guide practice, and challenging current practice in the agency with new research information. And you can see here a lot of the supervisors responded in a relatively positive way, but there's certainly in some states a lot less emphasis on this sort of work at this time. We also asked workers a number of questions, and again you see this middle range, maybe we are, maybe we're not, kind of response. Is your supervision an opportunity to reflect on your practice and how it's impacting clients? How in the world are we below middle range on that in 2 of the states and 3? I'm not sure what's happening in supervision if not that. And you can see some of these others. I'm running out of time. So the idea being that we have some real work to do on making it possible for this kind of thing to happen. It's not because supervisors don't know what they that this is important work to be doing. We're asking them to do a lot of other things during this time, and it comes back to the area of support. And if we begin to think about evidence-informed practice, which we all are doing, certainly, I think what we're beginning to learn is this idea of a supportive organizational culture, and there's a lot that needs to happen in the agency in order to make that possible, and in giving the supervisors the time to do that, modeling the use of evidence. If supervisors aren't bringing evidence to the table and asking their workers to talk through with them what this means, we can't expect workers to do that on its own. And then about relationship between the worker and the supervisor, and also the idea of vision, that using an outcomes-oriented approach is what you want to do. So this has been a very quick overview, but I think what I've tried to suggest is we have a lot of information about how supervision and child welfare is really the linchpin to a sustainable workforce, to organizational culture where quality practice can happen, practice enhancement, and improved outcomes for children and families. Thank you. Okay. You want no questions?
No questions to the end. Save your questions. Write them down. For those of us who can't remember questions from time to time.
Good morning, everybody. I'm delighted to be here and to have the opportunity to share with you some information that we're beginning to compile and its implications for supervision. All of you know about the disparities in the child welfare system. I don't need to say much about that. But let me tell you, I want to try to do two things in my 15 minutes. One, I want to talk to you about an institutional analysis process that we've been conducting. The Center for the Study of Social Policy in collaboration with Praxis International has conducted, I guess, 3 now institutional analyses, which are an attempt to use qualitative processes to begin to unpack some of the organizational contributors to disparity. And so we've worked in Michigan, we've worked in Fresno County to apply this methodology, and I'm going to spend a substantial amount of time talking about the methodology and what we're finding, and then talk about implications for supervision. We start with the assumption that organizations are designed to get the results that they get, and that if you don't examine the operation of organizations and the differential impact of policy and practice on different groups, you will not understand why we get the kind of results that we get. And so we try to analyze in this process a number of variables that shape workers' behavior. And this is really a significant shift in some ways in terms of analysis, because much of the literature is about the individual bias of workers and how we need to manage the interaction around ethnicity, race, and class with workers. This really is an organizational analysis. And I think in some ways that's what makes it so exciting. Because in fact, often what we've done is seen this as individual behaviors as opposed to the impact of organizational structure. So there are a series of things that we look at in the process that shape the behavior. One is the mission of the agency. Second is text. And text is merely all those forms that tell workers what information to collect, what to do with it, and those kinds of things. We look at policy and procedures, accountability structures, theories and concepts. What assumptions guide the operation of an organization in terms of the way they look at families, they look at children, they look at behavior, they design intervention. We've got conceptual and theoretical frameworks. Sometimes they're explicit, but sometimes they're implicit in terms of driving the operation. We look at training, resources, and linkages. And let me just say, these are the things that drive workers' behavior. Often when I'm working with frontline workers around issues of race and ethnicity, we talk about the moment when you're sitting at your desk and you know you have to do something, then you know it doesn't make sense. But the organization says this is what you must do. And so what we're really trying to understand is what's that normative framework. So I want to move quickly to highlight some of the findings. And let me just say, when we do this work, we go in for a week, we do interviews, focus groups, observations, and we do case readings. So it is a big team collecting a lot of data. It's qualitative data. We look at the themes across the data as they build over the course of the week. We generally do it in partnership with the agency staff so that we have staff engaged in collecting this data as well as our own folks. So let me tell you some of the findings that I think have important implications for supervision. First is labeling. We've seen significant labeling of both of these studies were focused on African American kids and their families, but the labeling of the families and the communities, and in some instances the children, with very powerful negative labels, shaped the nature of the work. And let me give you an example. There was one jurisdiction, sub-jurisdiction, that we looked at that had a contract for in-home services. And they had a gentle person's agreement that there was an African American neighborhood where services did not have to be delivered because the neighborhood was dangerous. Okay? And so that meant a whole group of resources that were available in other areas of that jurisdiction were not available in that community. And it was because of this notion of fear and labeling. And you hear it in the discourse with workers about those communities, that place, why do we have to go there? And then you also see it in the structure of the organization, because you may have highly centralized services, which means that workers don't have to go out into communities. Visitation is far from where the children and families are. So you begin to see the labeling influencing the allocation of resources, the location of services, and access. Does that make sense to people? So labeling and fear. The second big thing we found was what we have come to label policy mythology. And that is simply where there is a policy, the policy is not clearly understood, and in some ways it's differentially applied across communities. So two examples, in one jurisdiction there was a policy that said if there'd been a previous termination of parental rights, that when there's a new birth, there could be immediate action to move toward termination of parental rights. The could was interpreted as a must for African American families and children, and so you saw a baby, for example, who was born with a positive tox go straight to termination without a reasonable assessment of whether there was anything different in this family at this point in time. We saw it around age for relative care, that policy gets misinterpreted and it doesn't get caught, and it reduces the resources for families and kids. This, I think, from a supervisory perspective, is one of the most important things. Agencies didn't know their families. That, in fact, when we looked at the way that African American families were assessed, we saw little attention to their strengths, a lot of focus on pathology, even some instances where the descriptive information was shaped in a way to assure certain kind of judicial results. And there are real ethical issues there. But we found that in the process. But significantly, there are two things that we have all assumed would be helpful and increase equity that we found misapplied with African American families. Risk assessment protocols were not used as they were intended. People made decisions and went back in and then checked the risk assessment protocol to justify the decision they had had without collecting the required information. And I think that's really something that's important. The second thing was family team decision making. You know, we're all talking about family engagement. We saw instances in which team decision making was misused. The decision was made before the convening. And so the client came in, and all the language is, we want you to participate in this decision, but it was a done deal. And so it was the aura of decision making. And let me tell you, clients get it. They know when they're not stupid. They know when they're walking into a setup. And we would talk to clients, and they would say, we didn't go because we knew they wanted to remove our child. Okay? So those are instances where, you know, we see some misuse of the tools that really hold a lot of promise for us. In part because families weren't known well. They saw the services that were provided as not being relevant to their needs. You know, when you don't understand folks, and many of our agencies have a kind of cookie-cutter approach to the case plan, it doesn't fit for folks. So let me give you some examples of what we saw. We saw situations in which informal community-based resources were not valued as much as public institutional resources. So a mother goes into recovery in the county addictions program, doesn't work for her, goes to a church-based addictions program, achieves sobriety, but that program doesn't count because it's not one of the contracted programs. So even though she's sober, she hasn't complied with her plan because she didn't use the approved services. Location and access to services was huge. I'm getting the 5-minute sign, thank you. One of the things we saw in the last jurisdiction was a reluctance to accept evidence of change in parents, and therefore extending the duration of service. That in fact parents were testing for urines for 5, 8 years with negative results, meaning that they were clean. But somehow we just didn't trust it enough to close that case and let it go. Okay, limited advocacy for African American families. We saw some in the first jurisdiction, some evidence of differentials in accessing housing resources and drug treatment. Let me just talk about the implications for supervision. I want to start with really building on this assumption that supervisors are the bridge between frontline workers and the policy and management functions. And we need to create a legitimate expectation that supervisors look across their unit caseloads, identify problems in service delivery and policy, and inform the people who are in the position to make decisions to bring about change. We need to see supervisors as the standard bearers for good practice, and they must be engaged in the formulation of policy and training that supports good practice. Organizations need to support what I call the supervisor's demand for good practice. If supervisors are asking workers to perform in particular ways, if supervisors feel they need to take action when that performance doesn't occur, the organization needs to support that. a lot of places I've been, supervisors don't take action because they don't think that they're going to get the organizational support in terms of really evaluating and perhaps sanctioning performance. I think that across the board, we need to really think about what assessment is in child welfare, not only for black families, but for all families. We focus on assessing the event, and the risk and safety, but we often don't pick up on really understanding the families, which is a much broader kind of assessment. And that's why we're weak on the service planning, and it doesn't connect to families. Assure that these new tools that we're using, risk assessment, team decision making, are used in a way that they're intended. That we don't back into them, but we use them to develop an intervention strategy. Supervisors need to focus on the evidence of change in families and also focus on closing cases when there's significant evidence that change has occurred. Structuring regular feedback. And I think the supervisors need to really understand the policies, translate them to staff, and also understand both the restraints and the flexibility within policy so that they can use them to serve families. And let me just say finally, I think we need to continue to have a broader conversation about race, ethnicity, and class, and how that impacts the way in which we work, and how we can begin to mediate stigma that families encounter in our own agencies. Thank you.
Thank you very much, Carol. Kind of move in a different direction in terms of looking at the workforce and what the implications there in terms of what the workers are saying. Tracy? Oh, you could probably do that. You could do that. You could do this. Okay. And you could do that. Okay. Right. I'm good. Oh, and we'll give Carol back to us.
Good morning. It's a pleasure to be here today discussing the implications for supervision in terms of social workers and child welfare. As Joan said, we've conducted many studies looking at social workers who work in child welfare practice, particularly with our NASW members. But because our members tend to be more experienced, I wanted to look at the 2004 National Study of Licensed Social Workers because it had a much broader spectrum of licensed social workers across experience. And I thought that that would be much more instructive to our discussion today. A quick overview of the study. We had a stratified random sample of 10,000 licensed social workers from across the country, and we were fortunate to achieve a response rate of approximately 50%. We looked at several areas of social work practice, including social work services in behavioral health settings, social work services in healthcare settings, social work services for older adults, and social work services for children and families. And the information I'm going to talk about today comes from that last report. Joan told me it was this. Okay. There we go. I'm good. Thanks. Thank you, Joan. When we looked at the practice area that social workers identified, 37% of them identified mental health as their primary practice area. 13% identified child welfare family practice as their primary practice area, making it the second most common practice area, although it's also tied with health. The other area, aging, had about 9%, and 28% of social workers identified other some combination of other practice areas. It was interesting to find that nearly 80% of all licensed social workers provided services to clients that were 21 years of age or younger. And among social workers who provide services to children and adolescents, 11% of those identified child welfare family practice as their primary practice focus. So for most of this discussion, these are the two groups we'll be comparing. Social workers who provide services to children across the board, and those who provide, who identify child welfare practice as their primary focus. In general, social workers in child welfare tended to be younger than social workers who serve children in other practice areas, and younger than social workers overall. We found the median age for child welfare family social workers was 43 years old compared to 48 for those in other practice areas and 49 for all licensed social workers. In addition, child welfare family social workers tended to have fewer years of experience in the profession, a median of 9 years versus 14 or 13 for their counterparts either serving children or social workers overall. They were also much less likely to be MSWs than other social workers who provided services to children and social workers overall. More likely to have BSW degrees or no social worker degree at all. And let me just say something about that. Because it was a study of licensed social workers, it did include people who'd been grandfathered in who didn't have social work degrees. So that's why you see such a high percentage there. They were, however, as likely as other social workers to express satisfaction with their education and training and their access to continuing education programs. However, nearly 100% of them, 96%, reported interest in participating in future training on child and family issues compared with only 86% of other social workers who were serving children in other practice areas. There was significant evidence that child welfare family practice is a key entry route into the social work profession for new graduates. 22% of those in child welfare were recent graduates compared to 11% of those who served children in other practice areas. In terms of the sector, social workers in child welfare family practice were more than twice as likely to work in the public sector as social workers serving children in other areas. 32% worked in the nonprofit sector, 10% worked in the for-profit sector, and only 6% were identified in private practice. Overall, 3/5 of those who identified child welfare family practice were employed by social service agencies. And although direct services was the most common role for all social workers who worked in child welfare family practice, they actually spent fewer hours per week and a lower percentage of their total hours in this role than other social workers who provided services to children. The most common tasks they performed were referral and screening assessment, and that's pretty similar to the social workers in other areas. However, they were much more likely to provide crisis intervention services, less likely to provide individual counseling. They were also more likely to perform activities specific to children, including communicating with other social workers, communicating with other professions, communicating with families, using agency and community resources, and acting as an advocate. However, they were less likely to report that they were performing tasks above their skill level and more likely to report that they were performing tasks below their skill level. And performance of tasks below skill level has been associated with reasons for wanting to leave the profession. Social workers in this practice area were in more stressful job situations. Most of their clients were poor, with almost 75% of them, of their clients reporting Medicaid as the primary source of health coverage for their clients. And that's in significant contrast to other social workers who serve children and families for whom Medicaid is the primary health insurance for only 38% of their clients. They were more likely to report safety issues. 60% of social workers in child welfare family practice face safety issues at work, compared with 46% of workers in other areas and 44% of social workers overall. And they were less likely to report that they were satisfied with how their employers addressed these issues. So what we see here is that if you look at social workers overall, although 44% face safety issues, 70% of those were happy about how their employers responded to that. In contrast with the high numbers on both, that only 59% of those in child welfare were satisfied, but 60% of them actually faced safety issues. Vacancies is another area that we looked at. 40% of social workers in child welfare practice reported that vacancies were common in their area. 38% reported that their employers routinely outsourced social work functions, and 45% indicated that their employers hired non-social workers to perform social work jobs. You can see these percentages are much higher than either for social workers overall or for social workers serving children in other areas. They also tended to earn lower wages than their colleagues, and they were more dissatisfied with their wages, but actually more satisfied with the benefits they received from their employers. Supervision was identified as important toward improving care for children and families for the majority of social workers who serve children, and those in child welfare family practice were more likely than those in other practice areas to be actually supervised by a social worker. Those in social service agencies were the most likely to be supervised by a social worker, at 70% of those. We asked about changes in the service environment, and those in child welfare family practice were more likely than social workers in other practice areas serving children to report that the level of oversight had increased over the past 2 years when we did the study, that the number of court-mandated clients and eligible clients had increased, and that social work staffing in their agencies had decreased. These social workers were also less satisfied with very important measures regarding their practice. They were less likely to express satisfaction with their ability to influence the service design of programs they were in, to effectively respond to the number of clients who needed help, to improve the quality of life for their clients, or with the amount of time they had available to spend with their clients. They were also more likely than other social workers to assign importance to supervision, organizational support, caseload size, and manageable paperwork as the most important factors that would assist them in providing quality care to children and families. Regarding their career plans, these social workers were much less likely to plan to remain in their current position for the next 2 years. They were less likely to say that they planned to continue working with children, more likely to say they were ready to retire, and most importantly, and I think most significantly, they were more inclined to say they were going to leave social work than social workers overall or social workers who worked in other areas serving children. And some of the implications of this study is that even though social workers may choose child welfare for a number of reasons, it's clear that it's a key entry route into the profession. And the findings suggest, however, that once social workers are there, they face particular challenges, and perhaps most significantly, just feeling less effective and less positive about their ability to effectively intervene with families. And we looked at 21 factors that are associated with attrition from social work. And child welfare workers were most likely to be affected by at least 12 of these factors, including being recent graduates or in the first 4 years of practice, being assigned tasks below their level of skill, and working in agencies that recruited non-social workers to work to fill social work jobs. And although they talked about higher salaries, more interesting work, and job stress as the most frequently cited reasons for considering a job change, it seems that supervisors may have a unique opportunity to retain their professional staff by paying attention to other factors that in fact push social workers away from child welfare. And I think it's important because retaining this workforce is not only critical to child welfare, but it may be critical to the profession overall, because it looks like child welfare practice may also be an exit route from social work practice. Thank you.
Thank you very much, Tracy. And you can also will find the study on your flash drive, and make sure at the break, if you didn't get a flash drive coming in, they're in a basket out on the registration table with all of the resources. For the last presentation of this session, we will hear from Mary McCarthy about some of the work from the National Child Welfare Workforce Institute. Mary? You just need to press enter or click. Enter is the easiest.
Enter is the easiest. Great. Good morning, everyone. You've been patient listeners this morning, and I appreciate that and recognize the challenge of being last on this panel. And actually, I'm sitting here thinking, supervision. Do you need supervision, the ability to see far into the future, to understand many, many things, to take on this job as supervisor? And so I was also fantasizing about what the Wonder Woman or the Superman shirt would look like that we need to give these supervisors who are courageous enough to do this job. I'm part of the National Child Welfare Workforce Institute, so I want to just tell you a little about our partnership. We're in the third year of a federal grant. It's a partnership between 9 universities and the National Child Welfare Workforce, or the National Indian Child Welfare Association. We're in a cooperative agreement with the Children's Bureau. We're lucky to have Randy Walters here, who is our federal project officer. And we're really here to build the capacity of the nation's workforce to provide high-quality services to children and families and improve outcomes. So we focus on developing leaders, child welfare leaders across the spectrum, in public and tribal child welfare systems, and in private agencies that are contracted to provide case management services that are traditionally provided by the public child welfare system. So all of our work has really been in this workforce development area. Today, I want to particularly talk about the supervisory focus for this work. And if Frida Bernatovich wasn't away on vacation, she would actually be here doing this presentation. So I'm the stand-in, and Sue Eberston is here from the University of Southern Maine, who's really been a very key person in the development of this work. So supervisors obviously are the talk of the town. We are here to talk about them. Every state is talking about them. Every program improvement plan in the country is talking about them. They've become the key linchpin in the evolution of child welfare practice in this country. Why is that so? How has it come to be that this one job description has become so important in our service sector? We think some of that is because they make a difference in a worker's decision to stay or leave. They play a role in supporting frontline practice, managing workload demands, creating a climate of possibility within the workplace. And when organizations develop strategies for supporting a high-quality workforce, supervisors are always the cornerstone of that plan. Supervisors have traditionally been acknowledged as having three roles: that of educator, administrator, and support person. We heard from Crystal's data that there are many sub-domains to those three roles. Is there yet another role? Is there a role, a leadership role, within the child welfare workforce? Usually when we think about leaders, we think about the county director, the executive director, someone with a management title who's in a box near the top of the organizational chart. The ability, though, we think of our agencies to really achieve organizational goals such as assuring the safety of children and families, advancing positive and lasting attachments, creating permanency, and addressing the well-being of children, youth, and families. This is directly linked to the leadership capacity and contributions of frontline supervisors. But is this a new role? We don't think so. We think that it's a skill set that must be applied in every role that supervisors play. So how do we get to those skill sets? So the National Child Welfare Workforce Institute we really spent, I would say, 6 months, Nancy, would you say, about 6 months, really trying to think about what are the essential elements of supervision in child welfare. What are the competencies that are required to be to develop high-quality skills related to leadership? So this is our conceptualization of what that leadership framework will really look like. And both of our leadership academies, as well as our BSW and MSW scholarship practice, is now structured in line with this conceptual framework. And this model, you have a copy of the model and you have a copy of the entire competency framework on your CD drive. So I just want to talk a little bit about the model. So you can see it's divided into quadrants. And these quadrants are based on what's called a competing values framework. And that framework recognizes the complex and ever-changing reality of the leader's world. The need for the leader to be constantly balancing these competing priorities. So the model reflects the 4 dimensions of leadership: leading in context, leading people, leading for results, and leading change. Each dimension in the competency framework includes very specific competencies and skill sets that can be broken down by levels of leadership. There's also part of this competing framework are the 4 quadrants. Leaders have to work with internal flexibility, internal control, and external control. And those squiggly lines that you see, those are a double helix. And we used that purposefully. A helix is a biological design that's used to talk about DNA and RNA, which are the building blocks of life. And the idea there is that this chain of integration is required for supervisors to really be effective, that without those building blocks, without bringing these 4 quadrants together, it's very difficult for leaders to have the comprehensive skill sets that are required to do their work. At the bottom, we had the 4 pillars: adaptive, collaborative, distributive, inclusive, and outcome-focused. And 5 pillars. And these fundamental principles really reflect the desired qualities and values of effective leadership within the child welfare field. They provide a foundation for an approach to leadership that's very, very consistent with child welfare values and promising approaches to effective leadership. And when you look at the document that we gave you, each competency and pillars are actually illustrated within the document itself. I've given you just a few examples of what some of those competencies are within each of the pillars. So our institute is promoting the view that staff members at all levels of a child welfare organization are leaders. Consequently, the competencies associated are similar across job titles. What really changes is the proficiency that exists. And the reason that I think this is so important is what we've heard all day is unless the whole organization is living in this framework, supervisors are running uphill for the entire marathon. It's an impossible job. So it's really about, is the organization as a whole operating within this leadership competency framework? And then what are the skill sets of managers, commissioners, supervisors, and frontline practitioners that help move the entire organization forward? By developing this competency framework, the latter can become a basis for personnel activities, job performance assessments, career planning, and the development of professional development and training opportunities. And I really want to say a special thank you to Nancy McDaniel and Frida Bernatavich, Charmaine Britton, and a number of people on the NCWWI team that really developed this competency framework. And I think they hope to have an article out about it within the next few months. So here it is. This is the world of child welfare leadership. It is a world navigating in whitewater. Change is the word of the day, and what we're really trying to think about at a very deep level is individual change, but also skill sets that support change agentry over tasks, over functions on a day-to-day basis across the three main roles of child welfare supervision. So this is both an inner and an outer journey. It creates change in participants that attend the training, leading to change in the child welfare system. The inner journey focuses on deepening participants' understanding of leadership issues and principles. The outer journey focuses on applying implementation science to design and implement a change within the sphere of influence. Today, for the rest of today, I want to talk very specifically about the Leadership Academy for Supervisors. You can see the goal. The audience is really experienced supervisors. We're looking for people with more than a year's worth of experience. It is all online, and it's self-directed learning. There are follow-up sessions for supervisors in real time with moderators where they can meet with supervisors from all over the country. We really believe that many, many supervisors in our agencies today know only that world. Because the work is so demanding, they have a very conscribed area where they get to talk to people or become influenced by other ideas, so that this idea of beginning to create a national network of child welfare supervisors is a goal of broadening that lens and helping them think more expansively. The Leadership Academy for Supervisors is a 6-module online training. It's very consistent with the model. The curriculum is divided into an introduction and then 5 core modules, one each to represent each of the 4 quadrants that I talked about earlier. And the 5th is to focus on the center of the model. The knowledge of self is the foundation of leadership. The total curriculum takes about 30 hours to complete. And upon completion, upon completion of each module, participants can receive a certificate, a continuing education certificate. So just a little bit about the various modules. The introductory module provides a common foundation. It examines core concepts which are covered in more depth in subsequent models. Foundations of leadership, like good social work practice, focuses on effective leadership beginning with self-knowledge. This module includes self-assessment, leadership principles, a model, and competencies that are specific to child welfare. Building collaboratives provides an opportunity to develop the leadership competencies needed to create partnerships with families and youth, develop cultural responsiveness and linguistic competence, build on community-based services and supports, and collaborate within the system. Workforce development. We really believe, and I think a lot of Crystal's data showed this, that worker recruitment and retention is very much a supervisor's role. So this is an area where they spend time on building knowledge and how to be supportive supervisors around this concept of workforce development. They explore workforce issues, present promising approaches to recruitment, selection, development, and retention of staff. Accountability, data-driven practice. Again, I think the data that we saw from Crystal showed how infrequently supervisors are able to take the data, and we have enough data to drown in now in child welfare, but how challenging it is for them to really think about, how do I apply this in my work with practitioners and frontline services. So this whole module is around data-driven practice and using data to improve practice. Goal setting, the participants explore concepts related to change management, technical and adaptive problems, leading staff through stages of change. It's also an opportunity for them to synthesize their learning from the earlier modules and actually to participate in some action planning. I can stand up here all day. The words of the supervisors themselves are much more valuable, I think, and these are just some quotes from some of the supervisors. However, the task of getting to self-reflective practice requires time to be self-reflective. And what we know from a supervisor's job description is, how hard is that? How hard is it to take an hour once a week to complete an online training module, or to commit to an hour a week of face-to-face supervision with your workers? It's really, really hard. And why? The current work environment. We know workload, time, demands for accountability, professional development. When they do get away for training, it's usually focused on very specific job development that they have to participate in, paperwork that they have to learn how to complete, time for reflection, and the learning format. So the constraints are obvious. Now one thing, oops, I pushed the wrong button. One thing that we've learned about the learning format is the online learning format may not be, the kind of solo practice online learning format may not be the best way for us to be doing this supervisor curriculum. So what we're trying now, we have a special project with the state of Indiana, and it's led by the director of training, and right now 1/3 of the supervisors in the whole state are participating in this supervisory module, but they have a lot of support from the administration and from the management team within the state of Indiana, and that those internal managers are providing the coaching around the change initiatives. So for a supervisor to get to really thinking about what it is that they want to work on and change, to actually carrying out that change initiative while also carrying all the other roles and responsibilities that they have, has been very challenging. The link between the middle management training, supervisory training, and the BSW and MSW traineeships is built around this leadership competency framework. Our goal in training at these different levels is to end up with organizations where everybody at the management level is speaking the same language, where people are really operating from both adaptive and technical stances in their practice on a day-to-day basis, to understand those competencies and reflective knowledge and skills that are being taught. So the job now of many of you here who are state leaders is really to work with the legislature and policymakers to find a way to support supervisors as they struggle to develop their leadership competencies. It's not about a lack of desire on the part of the supervisors. It's really about the organizational structures rising to a place where that kind of learning and teaching is valued for our supervisors and frontline practitioners. It's really critical. One of the modules in the Leadership Academy for Supervisors said this, and I don't think I could say it any better. the quality of casework, the positive outcomes of service delivery, the successful recruitment and retention of workers, and the ability of the organization to function in times of change and stress depend on the recognition, development, and affirmation of supervisors as crucial organizational and community leaders. They need and deserve the time it takes to do their job in the way that they really want to do it. So thank you very much, and thanks to Frida and Sue for their help.
Thank you very much, Mary, for that very useful presentation that gives kind of the overview of the Child Welfare Workforce Institute and some of its work, and particularly the Leadership Academy for Supervisors. I think that what we've been able to do so far this morning is really to kind of get a snapshot both of sort of some of the really valuable strategies that are sort of taking place in terms of worker individual assessment, organizational assessment, looking at things from sort of a professional standpoint or from the voice of the worker themselves in terms of supervision. Now it's really an opportunity to ask some questions of this group of presenters. Basically what's going to happen is an opportunity to make comments or ask questions of the presenters. Then we're going to take a break. Then we're going to have 4 discussants representing frontline practice, social work education, consultation to sort of work on area improvement, and agency administration. And then after that, we'll have sort of a longer period for some discussion and comments. So this is kind of a good time to particularly ask questions sort of related to these presentations. And I know Andy had a question some time ago. We're going to give you the mic. We have the 2 mics to use. And it's good if you introduce yourselves again, just so for some of us that don't retain when people introduce themselves before. And plus there's a few other people who have joined us.
I'm going to be brief. I'm Andy Safir. I'm the Dean of the Delphi School of Social Work, but my real hat here today is that I had a conference we give annually on clinical supervision, on research and practice. I know some of you have presented and attended. First of all, congratulations. It's a great snapshot, as Joan used that word, of the state of the art of in child welfare. I think there's some themes that cross the board, not just in child welfare, but in other areas as well. No one will argue that supervision is important and good. One also recognizes, as you hear in these themes, that there's a tension between administrative, social work, and clinical supervision and other areas of supervision. I think that research in psychotherapy outcome, I think you'll find this in child welfare and sort of the work that Crystal's doing too, is that supervision has an indirect effect or direct effect on client outcomes. And also, I think the other piece of that is the quality of the specific supervision. And one of the striking things that happens over and over again when I give talks on clinical supervision is that if you're in a room, I gave a talk in New York City recently, there were 120 clinical supervisors there, and only 5 people have ever been trained in clinical supervision. And so part of the work that the Academy is doing, I think, is moving in that direction, I think. But one of the most important things is that we again get caught up with administrative supervision, clinical supervision, and so forth when really a lot of important work gets off to the side that's important to workers, which is really what you're calling education supervision. I call it clinical supervision, helping people become not just reflective supervisors, but having workers becoming reflective practitioners. So I think it would be really important on the state and on multiple levels to begin to think about how we are going to train clinical supervisors, what are the ingredients for these clinical supervisors to have, and what kind of resources we're going to make available to ensure that they have what they need so that client outcomes get even better.
Karen Kaplan, American Humane Association. I manage National Differential Response Initiative for the American Humane Association. It's one of the hats I wear. And when we have done some work evaluating through a field experiment where we actually had control and experimental groups, we obviously monitored the outcomes for families and services. But we also did some qualitative analysis related to the workers. And I was very surprised and pleased to say that there was an unintended consequence that was very favorable, and that is workers are significantly more satisfied doing the work that they were hired, they wanted to do when they were hired, doing a differential response approach because it does use those clinical skills, and you are doing social work practice. And that also goes for supervisors. And so one of the pieces, we use the work of the Institute of Applied Research in St. Louis, Missouri, and they've done a lot of the work that has been related to, in essence, as close to a random control trial in our field, which you can't do a whole lot of it ethically. So, and it's interesting because the same is true for supervisors. So if folks are more satisfied, is one of those institutional issues also that we're looking at. What is the nature of the work? I mean, we talk about administrative pieces, but the fact of the matter is, even with the administrative pieces, the fact that they were able to do clinical practice and work with families and build that relationship and follow the family's progress and be able to monitor it in a way that made sense, that had some depth, and they were able to do it in a flexible way that responded to the family's needs. What a surprise. They were happier.
Just building off the last two wonderful comments, Kathy Barr-Lawson, University at Albany, I'm reminded of the fact that when states like Illinois went through many reforms, got themselves accredited, and then got caseloads down to 12 or 15 per worker, what they found, which we find around the country, is that a low caseload doesn't necessarily mean that workers know what to do with all that free time. And so absent the competencies to be what has just been described as a clinical supervisor, which may be a proxy for meaning, for retention, for retaining one's own workers in one's work unit, as well as good outcomes for kids and families. I think what begs the question, what are the requisite credentials, skills that a supervisor needs to have? And is our paradigm the right paradigm for how units are organized, given that even if every school of social work in the country produced an MSW for every supervisory position that's open, I'm not sure we could guarantee that we've got the graduates for those positions. It's an empirical question. So I think we've got to look at different models to ensure what Andy described in this hybrid of, team-based supervision, but with rigorous and successful clinical supervision, and ask the question, if the supervisor does not have the competencies aligned with this clinical model, then to me it's just unraveling the whole kit and caboodle with potentially very, very problematic outcomes. We don't know how to ask that question about clinical competencies to get at what the consequences will be. And I think that's a key question for all of us. It's painful in hybrid workforces where you have some MSWs, some not. But I think we've got to care about that.
Charmaine next, then Annie, then Rowena, then Cheryl. Let's see if I can remember that.
Hi, I'm Charmaine Britton. My question is actually to Crystal and perhaps the rest of the panel. I think we've done a good job, and there's a lot of evidence out there in regards to what supervision looks like, the tasks around supervision. But my question is in regards to the evidence in relation to how do you do supervision? Is there any evidence out there about what is effective supervision? Does that mean that you meet with your workers weekly, biweekly? What about developmental supervision? Does that make a difference in terms of the satisfaction of workers, in that you treat workers differently based upon their longevity in their positions? So, and I get this question a lot when I'm out there, is how do you supervise? What do you do? Is it frequent unit meetings? what are those mechanical pieces of actually doing the supervision?
I think that's a very important question, Charmaine, and I don't know that I'm not familiar with a lot of good research that's really nailed what the link between those particular activities might be for outcomes, and what really is more effective. There's some data related to workers' perception related to that, and I know in our study we asked the supervisors. We did not ask the workers, but we asked the supervisors what specifically they were doing differently in their day-to-day practice. And a lot of it had to do with that they associated with the improved outcomes that they had described. And it seemed to be, yes, some of it more planned time, the typical clinical supervision things that we are able to do in other settings that often get pushed to the side in child welfare because we're so crisis-oriented. Having the time to spend regularly with workers, engaging and discussing their practice and those sorts of things. I think we need to have research in terms of what workers' perceptions are associated with that.
I'm Annie Brown from Howard University School of Social Work, and I have a general comment and question. And I really appreciate the information that was given today, because one of the things sometimes I see in talking with students, I teach family and child welfare, is people being able to feel that they're able to work in a child welfare setting using what they've learned, using theories and models of intervention, and somehow they feel there's a disconnect, that somehow clinical isn't connected to child welfare practice. And so I've often thought that it was really important for supervision to assume that role. And I think the other comment I have is because I think there is something else whenever we gather to talk about child welfare. There are just other issues out there that so impact our practice. And that is our relationship with the court, that we have huge responsibility without some of the authority that goes with it. And my colleague, Dr. Gordine, and I were involved in a study from the Children's Bureau that was looking at disproportionality. But we found that what we heard from workers, the voices of workers, is that they did not feel supported. They did not feel supported when they were under assault from the media. They did not feel supported by their supervisors and the agency. That whenever the media was factored in, whenever there was a sensational case, that they were left out to dry. And I've had more than one kind of grocery store conversation with some of my former students I've seen to ask how they are doing, and I get this back. So I think as we develop plans for supervisors and how supervisors are going to work, that we also develop leadership techniques for collaboration with people involved in the court system.
I'm Rowena Fong. I'm at the University of Texas at Austin, and my comments are based on my work with training child welfare students, co-PI on a child welfare training grant for students, and also my work is mostly in cultural competency, books that I've written, concerns that I've had, and in light of our changing child welfare populations today, I really do want to raise the issues, because supervisors really get caught sometimes, because we see a lot of frontline workers. Yes, we do have disproportionality in African American communities, but Hispanics, Latinos, you look at California, you look at Hawaii, and we have our Asian Americans. I also work with American Humane. We've worked with the Migration Child Welfare National Network. We've got undocumented families now. Unaccompanied refugee minors are entitled to child welfare services in our population. And clearly, some of you may know, recently knocking on our doors in child welfare is domestic domestic victims of human trafficking. Those are our sex abuse cases, those are prostitutes, our runaways. So clearly our supervisors are being challenged because frontline workers are being challenged with the changing faces of our populations. So in light of that, what kind of training? What kind of training are we doing? What kind of help, support are we giving to supervisors that are being challenged by their frontline workers? Because they come to the supervisors and they want to know and they want to be supported. So that's probably just a comment in terms of looking at our changing population in terms of child welfare. The second comment that I want to make, but kind of ask Crystal the question, in your data you showed that question that asked yes, and the question was using research in practice. 2 states reported 60-70% that looked great. One state reported 38% that did not look so great. So could you kind of either describe the state or what are the factors? This is my SWOR hat now. It's like research informs practice, practice informs research. So what is it that we need to do better, either researchers or practitioners coming from child welfare? How can we make this a better collaboration?
You know, I think one of the things that gets in the way of that happening is whether or not the agency has a process for getting research condensed in a easily digestible form that's directly related to the frontline practice to supervisors in their hands on a timely basis. And I think some states do better, and some states have tried to have research summaries out there or ways to do that, and I think other states really don't do that. And I think we need to find ways to get information. I don't know how reasonable it is to expect frontline supervisors in child welfare to read all the journals. They don't have access to them, for one thing, so unless they're students and have access to a university. So I think part of it is the challenge to all of us is to find ways to get that material to them in brief bites. And I know that, for example, North Carolina has done some work. When Nancy Dickinson was there, they did a lot of work in trying to get that kind of information out. I think it was either monthly or quarterly in terms of here's a good study that is directly related to your work.
I think she was first. Oh. Well, I just want to congratulate Cheryl Brissett-Chapman. I want to congratulate the panel. I'm so overstimulated now. I hope we can resolve this today. Carol and Mary, this whole issue of disparities and leadership. I was just thinking about a conference years and years ago where Tom Morton and I got in trouble because Tom Morton agreed with me for the first time about something, that the child welfare system, African American children were economic fodder. And that is still an issue as we think about this for the child welfare divested system. And I'm going to speak from the private agency side because I'm local. And one of the other big secrets is that we spend a whole lot of time in child welfare fighting about what modality works, where results is child by child, right? Child by child, really at some point we should be held accountable to that child's perception as an adult of what difference it made in their life. And so from the private side, I see some of the real residuals of the early line intervention in the public agencies playing out, all right? And we too are held to the same standard, permanency, safety, and well-being, but we now have children with legacies of separation and removal. And so when I hear your panel, I hear this, with the workforce specialists here, that we're looking for someone who has the brain that can integrate vision, planning, and action with a transparent, highly scrutinized use of self, who can balance creativity and humane response with experience and community standards. Now that's the line supervisor. So my question is, that's like the boot camp guy in the military, right? Understands defense, understands what it means to bring these people in, and really prepares them to do that. Now, we know in a voluntary military force, everybody can't do military. Everybody that wants it isn't going to do it. They've got to be equipped. So my question to the panel, when I heard someone say that in 50 years, anyone who's 50 years or older, and there's a few of us that look like we are, that we've experienced 1,000 societal changes. changes the diet. It's going to be worse. And I'm looking at staff, and I'm looking at my supervisor who said to me, Doc, I asked, can you pass me the straw? And the person doesn't answer me with their MSW, LGSW. And I'm wondering, is there something wrong with me? They don't seem to know you're supposed to say, sure. That the social media, the generational mix, we have folk coming into the field that cannot interpersonally communicate across generations, across cultures, basic stuff. All right? And the supervisor struck with changing demographics. There's no such thing as a black child anymore. We have black children coming from around the world, second generation, third generation. So we begin to look at how do we talk past stereotypes, Carol, when we have folk who will come, anyone still gets to play in child welfare, and we're looking for the bodies. What's the brain? I want to end with this. Chief Lanier was talking about this program where they were taking seniors from high school, Anacostia High School and others, to prepare them for the police academy. They would take them, pay for them to go to UDC, get their 60 credits, which is now a requirement, and give them part-time work. And they said they had to go down to the 5th grade because by the time they got to be 12th grade, they were already in a position where they could not go into the program because they already had a charge. Does that make sense? They had to go down early in the game to help influence this very changing brain around how do you connect the future to yourself today. So you have the lust to be a leader. We don't hire people and say we want you to lead. You have to be able to be mature enough to take the risk. You've got to be able to be a social worker that influences your organization, not just sit back and say the organization has to support me. You have to be a driving wedge in disrupting those policies. If it's wrong, you don't do it. We're looking at maturation now. So could you comment about who's entering the system, Tracy? But are we really serious about the results for kids? Because we hire anybody, and we don't expect them to have the brain that can lead. We do not. And I don't buy you can just train people who have no clue that they're supposed to be leaders or have no lust to do it.
Okay, Cheryl, you've set out a challenge for if we have any response in about 2 seconds here because we have to take a break. You going to answer this question, Tracy? We do know that Tracy has an upcoming webinar, or if she hasn't already done it, on working in a multi-generational work environment. Anyone else want to take this on, or we will take a break and come?
I guess I do just want to say, Cheryl, I think you've really summarized the challenge beautifully and also the charge. And I think recruitment and selection is huge. We should not just be talking about recruitment and retention. We should really be talking about recruitment and selection and what conditions or criteria, what kinds of behavioral interviewing, what are we saying when you pass the warm and breathing test and you get a job. I think it's really problematic it's a message. It's a message to everybody. It's a message to the kids and families, and it's a message to the other staff in the organization. So the United States is set up very interestingly, and I'm going to use New York as one example. We have 58 counties. We have 58 union shops. Every one of them has an individually negotiated labor contract. We are struggling to influence recruitment and selection. It is a huge challenge. But before I die, I'm going to make a change in civil service in New York.
One of the things that's been in my mind is that when we talk about retention, we need to be really clear that not everybody needs to be retained, okay? And that's part of what I was alluding to in terms of supporting workers in their challenging staff, frontline staff, to do the work properly. That retention is important, but it's retention of the people who can do the work and not retention of somebody who just because they last 6 months. And so I think we need to be still having this dialogue about connecting competency to results and letting that be part of the way we evaluate people in terms of the appropriateness, their appropriateness for the job. There's got to be a fit. Now, let me just be clear. I came into this work with a bachelor's degree in zoology. Okay? Was I prepared? Absolutely not. But something worked for me. But we see people in our systems that are just there without necessarily the commitment or the skill to do the job. And you know, I've been teaching MSW students. I've been fortunate because we've had very strong students who come there because they want to do this kind of work. But even with that, some of them need to be coached into another line of work. So let's make sure that retention of 100% is not the goal. It's really retention of the people who can do the job. Yeah.
Okay, Tracy.
We're a pretty silent panel, right?
Yeah, I knew.
One thing I just wanted to comment on is that my observation has been that with child welfare being the starting point for so many new graduates, and they get trained and then they go on to do more important work, working with paper and things that don't get hurt if you mess it up. And I think that we need to look at, you know, the experience, the judgment that people need to do this critical work in hospitals. Those physicians who do emergency room medicine, they have more training. They have to go through more rigorous training, and I think our model's almost upside down, where we really have discouraged people with more experience and judgment from being in child welfare, and we see it just as a training ground, and I just need to get my 2 years and then I'll go do something else.
Well, I want to thank our panelists. I want to thank all of you. I know others of you had questions and comments. We'll have more opportunity to do that because now we're kind of running a little behind schedule. Let's take a 10-minute break.